everyone, this is Amanda again, and today I have came here to talk a little bit about Canadian healthcare and how it works and how was my um, experience with it. And I've decided to make a actual break it down kind of video explaining like all of details that I can think of for people who are coming here, especially people who are coming here as students, because that's my situation, so I can advise a little better because I have my own experience to talk about. And I know that there aren't that many videos on YouTube talking about it that way, so if you appreciate me coming here and bringing this content, please make sure to like the video and also subscribe, because I am currently focusing on content talking about me coming here to Vancouver and giving you guys tips, my overall experience, and just some lifestyle kind of videos as well. So starting to talk about the healthcare system. So we all know that the Canadian healthcare system is free. So basically they do have a free healthcare, but that doesn't mean that the system doesn't have any problems or it doesn't have any issues. So before coming here, I would hear many types of different stories from people. Some people would say they had a terrible experience, and some people would say that they had a very sweet, smooth experience. And of course, I'm talking about people who came from Brazil and were living in Canada. Because I would come to them to ask about their experience and how that would go, because I was concerned about my medications, because I'm a person who needs medication that needs prescription. So I knew that many medications in Canada, they do need prescription, and in Brazil they wouldn't need it. So I was concerned about that. So I wanted to ask them for them to talk a little bit about their experience, and I've heard many different types of stories, which kind of made me more confused. Then it didn't help that much, but I think it was good, because then I could see that you can have different experiences with this healthcare system. So for starters, I'm going to make a comparison between the system I have in my country, which is Brazil, and the system they have put up here. It's not just a free healthcare system, it's a public healthcare system, and you don't have another option. That's really important for you to understand. They don't have a private healthcare system. The private healthcare system they have is for things that are not covered by their public healthcare system. So basically, like, for example, going to the optometrist, like to get prescription for glasses, I don't think that's covered, or physiotherapy, that's not covered, or psychologists, I don't think that's covered. So all the services that are not like necessarily medical, they're more like therapeutic, or in the case of the glasses, just some kind of extra, like dentist, for example. These are not included in the public healthcare system of Canada, but everything else is included in the public healthcare system. And you don't have an option of getting a private service for those for these cases. So you don't have, let's say I want to consult a dermatologist. I cannot go to a dermatologist and pay for my consultation, and this dermatologist is a private dermatologist. There is no private dermatologist. Every single doctor that works here works for the government. So Every time, even if you go to a doctor here, and let's say that you pay for the consultation, you are paying for a government service. You're not paying um, the doctor itself. It's not a corporation. It's not private in any way. So that means that when you come here as a student, and now I'm talking about 2025, you will have access to this healthcare system if your visa is longer than 6 months, I believe. So if you're going to stay for longer than 6 months, you're gonna have access. You can apply to get access to the government MSP, which is the medical service plan from your province. But usually it's gonna take a while until you're able to actually have access to the service. So they will have different periods of processing your request, kind of thing. So basically, when you come to Canada and you have your and you have arrived already, you can already go to the website and apply, because here in British Columbia it takes about 3 months until they process your request, and then they send you the card that will give you access to their healthcare system. So it takes a while. So that's why you should do it as soon as you get to the country, right? So that's what I did. And even before those 3 months finished, I have already received like a letter on the mail telling me that they have received my request and that they're going to be sending me my card. And then after a while, they sent my card through mail. And when I received my card, I think the period of 3 months it hadn't finished yet. But you have to be careful with that. You need to read the document that they send with the card, because even if you receive your card before the period of 3 months end, you cannot use it before this period of 3 months end. So usually they will say when you're able to start using the services. For me, it was July 1st, and I've arrived in Canada in April 25th. So that will give you an idea of how long I have stayed, like how long it took for me to have my request processed, to have my card, and then being able to use the service. So this is very important for you to understand that for now, 2025, being a student, you will have access to this service, but you will have to pay a fee to be able to use this service. So right now in 2025, you pay $75 per month to be able to use the MSP service. So you are going to receive a letter on the mail, which is very important, because on this letter they're going to give you like a code, where online this code, the number of your account, if I'm not mistaken, you are able to go on the website, put the code, and then you're able to pay. And I strongly advise you to register your card on the website so that they can have an automatic pay, because if not, you're gonna have to be waiting every single month for the mail to arrive, and then you go on the website and then you pay again. And it's kind of stupid in my opinion. You can just put it in automatic pay, and then they're going to charge it in your card every month, and then you're not going to forget. The amount is always going to be the same. It's a government issue thing. So and it's faster, it's more practical, and it's simpler. So I strongly advise you to do that, and that's what I have been doing. So this is a little bit, this is about the process, about getting the system and how the system works. This is what I have explained to you so far. Now I'm going to explain to you, well, what if in 3 months, those 3 months that I'm waiting for my card and I don't have access to the public health care, what option do I have? You're actually obligated to have a private in health insurance plan. You have to find one. In my case, my college, they gave me for free, actually, that it was included on in my studies, with just paying for my college. They would give me this insurance plan. It was called Guard Me. And then you have to actually have the proof that you have contracted, you have paid for a private health insurance plan. As you arrive in Canada, you need to prove, because you need to have an option. You cannot just come here unprotected. If something happens to you, you have to have some type of coverage. So this is what happens. So you're gonna have this insurance, and then according to your insurance, they're gonna be covering the costs for, in the case of you wanting to have access to some service. So I haven't needed to use private health insurance during those 3 months. Gladly, I didn't have any type of trouble. I have brought my medication from Brazil. You're allowed to bring exactly 90 days of medication with you from your country. As long as it's not a controlled medication, you can just bring like the prescription from your doctor, the translation for the prescription, and then you can use the medication for those 3 months until you have access to an actual doctor. And then you can get your prescription here and then buy more medication here. Okay, but that's the thing. I didn't have to use the private healthcare, the private health insurance that I have contracted with my college during those 3 months. So I don't know much about how that works, to be honest with you. But I had a friend that had an emergency, and he ended up having to actually be taken in an ambulance when he got here. And he had the same exact health insurance than me, because he also studies in the same college as me. And during that time, he went to the hospital, which is a normal hospital, government issued kind of hospital. He went there, he got the service, everything was okay. And then after that, they got his data, his information, because then they would send to his address the bill for the services that he used that day. So after he got that bill, he had to go to his health insurance to see if they could cover the costs. So as far as I've seen, he said that part of it was covered, but not all of it. So that's something you need to be aware of. So the health insurance you hire, they might not cover everything. They might have some conditions to cover things. So in those cases where they don't cover for it, you will have to pay for it. So for him, because he used an ambulance, I believe he said it was like, I don't remember how much it was, to be honest. But I remember it was not a cheap price. So please be careful with that a little bit. I have talked about that a little bit on my TikTok, about how it's important for you when you come to Canada. Do not let go of your health when you come here, especially throughout those 3 initial months you're here. You might be coming from a different environment, a different weather maybe. For example, for me, I came from a completely tropical kind of weather, and I came to a place where it was cold, and that was a change for my body. Luckily, I didn't have any trouble because I didn't let go of my health. I was having a good diet. I was taking vitamins. I was doing everything I could to make sure that my health would hang on straight until that 3-month period would end, and I would be able, if I had some type of trouble, I would have access to a doctor, and I wouldn't have to worry about being able to pay the bill or anything like that. So I strongly advise you, even if do try to not go out every day and eat pizza every day, because that bill might come to you later in a totally different way. So I don't think it's worth it, and I strongly advise you to take care of your health, because it might not be pretty. So this is the experience I can tell you about the private health insurance. You obviously have to see what are the conditions for your private health insurance, because each one will have different conditions and different rules, right? For me, this is the only experience I can tell, because I personally haven't used it. So now that I have told you about the private health insurance and for students and how that works, I'm gonna talk about my experience using the government, the MSP, the Medical Service Plan of Canada, and how that worked. I have used it a few times already, because as you know, I needed prescriptions. There were a few issues that I wanted to take care of. When I got here, my skin got really, really bad. My acne got way worse than it was before. And it got to the point where I needed to talk to a doctor. I also needed to remove my IUD I put in Brazil, and my body was not adapting to it. So I had lots of little issues that I needed to take care of. So firstly, one of the options I have looked for was online doctors. So basically, I have used a website called Tia Health, and it's excellent, honestly. Because if you have small medical requirements, you can just go on this website. They have doctors, and I'm not receiving anything to talk about them, okay? It's just because I've used them, and there are other websites you can use as well here in Canada. So basically, you will see the doctors that are covered by MSP, everything, blah 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 blah. Even if you don't have MSP, you have the option to pay for these doctors online. I believe so, because they have asked me, are you covered by MSP? So you could either say yes or no. And I think if you say no, you probably can't pay for that consultation. So basically, you can do it by video chat or by call. I did it by call. And you will see the doctor for the specialty that you want, a general doctor or specialist, and they will have different schedules. You'll be able to pick the time that you're available and the doctor is available, and then they're going to call you at that time. And then it's gonna be basically like a 15-minute max kind of call. And during this call, I've had a good experience with my doctor. He was very helpful. Before I had the consultation, I had to fill in a form with all my information, so why I was going there. So basically, when he came to call me, he already knew what I wanted, kind of, I just needed to give some small details, some confirmation to him. And then after that, he sent me he will send you the prescription, or the requirement for an exam, because I needed to have a blood test for one of the prescriptions for the acne medication I wanted to take. And he basically sends it to you by email, and the prescription itself, he won't send directly to you. He will send you to your drugstore. That's something different from my country, for example, because in Salvador, where I come from, the doctor would give you in a paper, by paper. Okay, in some cases you can have it like online, but you will have the document with you. You have to take to the pharmacy, the drugstore, show the person, and then they would have some type of QR code to check if it's legit or not. That's not how it works here in Canada. The doctor will ask you what drugstore you want. Then you can pick the drugstore that's nearer to your house, and they will send the prescription directly to the drugstore system. And this is really important. Basically, you need to go there to ask for the medication. So, because they will manipulate, they will do the medication themselves. It's like they don't have it in stock already, basically. Some of them they will, but if it's a prescription medication, probably they will do it. There will be a pharmacist that will like make up the pills, basically. So you need to go there and then tell them, oh, my doctor sent to this pharmacy my prescription and everything, and I wanted to get it done. And then it will vary depending on the medication you're asking for. It can take about a few hours, or 24 hours, or 48 hours until your medication gets ready. And then when it's ready, sometimes they will send you a text. You can ask for that. Some pharmacies will do that when it's ready, and then you can come and pick it up, right? That's very different from my country, because they would just have it ready and I would just pick it up right there, just showing the prescription. They would get it and give it to me. So it's different here, right? And also, if you don't want it to get it done, like for example, if you want to get a refill, this prescription, probably he will have like the amount. For example, for this type of prescription, he will put it there that I can have 2 refills with that same prescription. So I don't need to have a new prescription every time I need more medication. That was how it worked in my country. I would need to go to the doctor again every time I needed more pills, right? They could give you a prescription for you to get like multiple bottles, but you know, that was a constant thing. You would always have to go there. And here the prescription, it has it's valid for a year. So like I find this great and crazy at the same time, because like, yeah, so that's the expiration date for the prescription. And you have usually you will have certain amounts of refills with that same prescription. So every time your let's say you got the medication for 30 days, in the end of 30 days they will already, if they have it in the system that you have refills, they will probably automatically like start doing the next one. So if you don't want it to get it done immediately after your stack runs out, you actually need to tell them. You're like, oh, I don't need you to prepare this medication yet for some type of reason, and then they will, hold it up. Just letting you know, because that happened to me. So this is my experience about prescription medication and everything. For exams, for examinations, like I said, he sent me a request for the exam, and then I just had to schedule online on a lab that would do that type of examination and be there on time. And honestly, for exams, it was super quick, and very on schedule. But I got there early, and I remember the first time I got there early, 20-30 minutes before my time, and they have attended me like right away. Like I just got there, then I went to the chair, they got my blood, and that was it. And then after that, the results also go directly to the doctor. So you don't need, if you want, you can go online and see the results yourself and have it like on PDF or something. But if you don't need to, because you don't need to take it to the doctor, because they send it to the doctor that requested the exam right away, right? So this is how it works. So this is how it happened for me for some time. And then you might ask, oh, but what if you want to visit a doctor like in person? What if you need an in-person examination? What if you have an emergency and you need to visit a doctor in person? Well, I have some things to tell you about that. First thing, if you have an emergency and you have to go to an emergency room, I haven't been to an emergency room yet, but I have met lots of people who had to go to the emergency room, and I'm going to be very straightforward with you. It isn't good. It isn't pretty. It's very crowded, and you might wait 4 hours to 6 hours, 8 hours to see a doctor or to get whatever service you need done. And sometimes, even if you have a big emergency, you can wait this long. I had a friend who fell, and basically she had a cut on her forehead, and it was bleeding. And she told me she was there for a long time, bleeding nonstop, and for hours, and she thought she was gonna die because she was getting weak and no one would come to see her. So yes, it is really bad. Just being straightforward with you about that. But here's the thing, and that might be very, like, you can feel very desperate listening to this, but there is an option, and I'm gonna tell you right now. So first of all, to avoid all this wait time, you can either, if it's not something super terrible, like, I don't know, a broken bone or something, you can go to an urgent care, primary care facility, which is like, it's like a smaller clinic that's not a hospital, but they attend people like for emergencies, but like mid emergencies, like not, you know, big emergencies, like, you know what I mean, like, so if you have an emergency but it's not something that would need a surgery or something of that sort, you could go to the centers, because usually you might wait a bit less on those centers. They're everywhere mostly, so you can just pick a place and go there, and you might have a bit less of a wait time, and that's an option you can go for, right? And the other option is, and this is the most important part of this video, having a family doctor. Well, here in Canada there is this thing, so basically they like to work with prevent kind of medicine. So basically they want you to have a doctor that is your family doctor, that's going to follow up with you and know everything about your health. And this doctor is going to be your primary carer. And every time you have a problem, you will go to that designated doctor. And if you have a problem that this designated doctor cannot solve, then this doctor can refer you to a specialist. So as I understand, you cannot go to a specialist right away. You would need to have a referral from a general practitioner or a family doctor, which is a general practitioner, but it's one that follows up with you. But how do you get this doctor is the problem, because this doctor, basically, you can sign up online on a list so that the government technically will send you one doctor to take care of you after a while. But I'm going to be very honest with you. I have filled in the form. I have registered on this website, and I've never got a return. And I've been here 6 months. Okay, and I've heard the very same from different people. So that website doesn't work for you to get a family doctor. You're supposed to register there, and then the government will basically assign you a doctor, and that's gonna be a doctor, but that doesn't work. Okay, that's my experience, at least here in British Columbia. So then, if that doesn't work, how do you get a family doctor for yourself? So this is the path I have done. Usually it's by referral. You need to go around talking to people, asking, oh, are you here for this and this long? Do you have a family doctor? How did you get a family doctor? Is this family doctor accepting new patients? That's one thing you can do. Other thing you can do is walk around, and if you see a clinic, a family doctor's clinic, a medical center, you can write down the name, look up online, and see if they have new patient intake forms. See if that clinic, any doctors from that clinic, is accepting new patients. So basically, it's not just picking a doctor. It has to be a doctor that is available to take you, because usually they have their own list of patients, and that's their list of patients. They will attend those people and follow up with those people, take care of these people if they have any type of emergencies of problems. These are their patients. So they won't take more than that amount. You know what I mean? So you need to find a doctor that is willing and has a spot for you, basically. So what I did was I have asked around, and then there was this friend of mine who said, oh, I have this clinic, I have this family doctor that's Brazilian and she's really good. You can send an email. This is what I did. I sent an email. They asked me to fill in a form, and then I got to be her patient. And I was like, okay, let me try to do that. And then I did the same thing, but then they answered me saying that, oh, this doctor unfortunately is not taking any more patients. So basically, it worked with him because he got lucky, because at that time she was taking new patients, but she isn't taking new patients anymore by the time I tried to be one of her patients. So this is what I did. I have went to multiple websites, looked it up. I saw all the ones that were near my house to see if they were taking new patients, and I would send an email. I'll be like, is there any doctor that is taking new patients right now? Are you taking new patients at the moment? That's what I did. And then eventually, you remember that doctor that I told you, when they gave me the response, I responded back because I was desperate, and I was like, okay, so this doctor is not taking new patients. Do you have any doctor in the clinic that is taking new patients? And then luckily they responded back saying, oh, actually we are having a new doctor to be a part of the team. She's just coming to be a part of the team, and she's going to post on the website her patient intake forms in a few weeks. So keep looking up on our website, because we're probably going to post her forms in a few weeks from now. So this is what I did. I was like every single day refreshing this website until they've posted it, and then I've clicked it, and then I've signed up for it, and then immediately, like a few hours after I filled in the form, they called me to schedule a meet and greet with my doctor, and now I have a family doctor. So what does that mean? That that means that if I have an issue, I can go to this doctor, right? She will know all about my health, everything that I need. If I need a checkup, if I need if I have a problem, I break my leg or whatever, she can also, like, usually in the clinic they can, you know, refer you to a specialist or do some types of examinations, x-ray, everything. Usually the clinics are big, so for overall, like, problems that you might have, you will go to your family doctor, right? Once you have a family doctor, your life gets way easier, right? Because most emergencies, this doctor will be able to take care of, right? And then you won't have to be going to rooms all the time, because you can go to their emergency room when you have a problem. So basically, this is the thing about the service in Canada. You need a family doctor. That's it. Once you get your MSP, that's the way to go. You go on clinics, looking up, asking people around, just to get someone who's able to take you, and you do all the right process so you can get a family doctor, and that's it. So this is my experience with the MSP so far, and yeah, it's not that bad and it's not that great. There are good things and bad things. Like I said, the emergency room is chaos. It's terrible. But for overall problems, most of the problems can be done and can be solved by having a family doctor or searching for other alternatives. If it's something that you can do online, you have that option. It's covered by the government, so it's great, right? And so this is it. It's not perfect, but it does work if you go through the necessary steps. So yeah, if you enjoyed this video, please like and comment below if you have any questions, what you thought about it, and please comment where you writing from. I'm very curious to know where my video is getting. So tell me the city and the country that you are talking from here below in the comments. And please make sure to subscribe, because I'll be bringing lots of other contents like this. And it was a pleasure to talk to you today and I hope to talk to you more next time. So see you again next time. Bye.